I don't know that 2 weeks will become 20 years. From 2 weeks to become 2 years, 20 years, you know. I'm Dr. Christopher Hemady. I'm from Philippines. I'm practicing family medicine, staying in Xiamen City for almost 20 years. Our clinic is Fujian medical consultancy. We can do a complete examination. We can explain to them what's their condition in a Western way. And this is our, we call that the treatment room. This is where we do the procedure. So we check everything here. We can check the ear, we do the ECG here, everything related to the patient here, the complete physical examination here. I was working with SOS. They sending us to different places for emergency. In 1998, they said, we have problem in Xiamen, or maybe you go there for 2 weeks. They assigned me to work in Xiamen as a medical consultant for Kodak. In Kodak, we have around more than 200 employees there. Yeah, right? Yeah. This 1, 2, 3. The senior doctor have one room, and I have another room here. Maybe 1, 2, 3 until there. This area, all our clinic.
卫生局呢了解到说，柯达是由一位国际救援中心派的外籍医疗顾问，就想给这个医生在国内的工作提供一些便利，给克里斯举办了一场现场的考试。
Luckily, I'm the first foreigner to secure a medical license in Fujian. I really admire and respect those officers of the Health and Sanitation Bureau for their kindness and professionalism. The general manager secretly talked to me. He said, can you just set up a clinic for us? Because we still have a lot of employees, around 200. So at least we have some place to go where there somebody gets sick.
So the language barrier going to a local hospital is very difficult. And he speaks English, so he understands our needs. So it's much easier for us.
If the patient already very sick, we need to bring them to the hospital. One of my story is a German patient. And he's seated here. He said, I have stomach pain. He seems a little pale. And I told them, I need to examine you. He said, no need. Just give me some medicine. And then what happened is when I examined the patient, he doesn't have any problem with the stomach. I listened to the heart. The heart beating is irregular. We found out that the heart already starting to have damage. When we bring him to the Xiamen Heart Center, they found that the heart already blocked. The doctor said, you cannot go home anymore. We need to put a stent. We did the operation there. During admission, we're also there. My nursing staff will also translate for them. We make sure that patient question is answered.
Some foreigners, they don't know you yet. They try to consult in the local hospital by themselves. And even the doctors there is, you go to look for this doctor, okay? Find this clinic and doctors, find doctor. Find Dr. Chris. So the hospital also pushing the foreigners here.
Dr. Chris was recommended by the school that I worked for. It's going on 3 years now.
And the feet until here. Did the ECG for her, and then the ECG, this is the left side of her heart here, and the beating is very regular, really good one. Blood pressure without any side effect for her.
我们就现在就先给您检查一下血的结果出来以后，之后看看那个药要不要换成药。那等你们休息。好，拜拜。好，马上拜拜。
Actually, she's working visiting there. There's some store there, and
Our company on the first floor.
how attracted to her. And I keep on, I go there, I try to talk to her, and she don't want to talk to me. And then I saw her again there, and I insist to be talk with her, you know, and she started to talk to me, and then we just become friends. Now I have two kids, 12 years old girl and a 7 years old boy.
我现在最擅长画的爱就是动物啊。
I don't know that 2 weeks will become 20 years. Everything is accessible. Everything is convenient here. The people also here are nice. You can see they will call me at the middle of the night for emergency. I'm not even worried to go out. Very, very safe. Anytime you go out.
So he even can go up the mountain at the night time by himself without any worry.
Yeah. I usually go up there around 9 p.m. because I finish work sometimes late, so I'll go up.
I want to be like my dad, a doctor, because he takes care of sick people and he gets the treatment with lots of nurses.
What kind of doctor you want to be?
A doctor that helps patients.
One, two, three. We will do 30 compression. 30 compression. Okay? The depth should be about 5. We're offering some free training for the teachers. We teach them if something happened at school, what to do. And the foreigner in the community, we teach them also about if something happened at home. You have to call the 120 or something like that. We also gather some money. We were able to buy an automatic external defibrillator, and we donated it to the community. As a doctor, we're also very shy we cannot give anything back to them. So I think the only thing as a doctor can give to them is teach something that we know. The simple emergency can be handled correctly, and probably that will save life. I think it's a small contribution to the shaman.